Currently in the UK, there are around 6 million patients waiting for care, driven by roughly 8 million missed NHS appointments at a loss of approximately £1.2 billion per year. The effects are staggering. Not only do missed appointments lead to poorer health outcomes for patients, but they entrench health inequality. London-based Deep Medical was early to identify this problem, striving to uncover the reasons behind patient no-shows. We sat down with co-founder Dr. Benyamin Deldar to learn about the scale of this challenge.
In the NHS, we have one of the worst health inequalities in the whole of Western Europe. 10 years of life expectancy between the richest and poorest, 20%. About 15 years of unhealthy life difference as well. So not only are you dying earlier, but you're spending more of your life in and out of hospital as well. And when we look at the data, we see it's those same population groups that are struggling to turn up to their appointment. When you look at the outcomes, you see that if you do miss appointments, you have much worse outcomes. It's actually something called patient engagement or compliance behaviour. Often it's the difference between why one patient will deteriorate faster than the other. And when you look at the outcomes from the data perspective, there's a lot of research which shows that even just missing 2 GP appointments a year can increase your all-cause mortality by about 3 times. So you're 3 times more likely to die than the same patient, the same condition. So the problem really is that we have an operational challenge that translates to a societal challenge, that translates to a clinical outcome challenge.
Deep Medical leverages the predictive power of AI to identify patients likely to miss their appointments or cancel at short notice. This enhances clinical efficiency, reduces waiting times, and by extension, saves lives. So just how does Deep Medical achieve this?
We pull data from the historical administration systems in the hospitals. We don't touch any healthcare record information. We don't touch any sort of sensitive information at all. But what we do add is a lot of features that we can understand about the patient and their lives. So the type of work they might do, where they might live, the traffic, the events that are going on around them on the day, or even things like the weather. And what we're able to then take is a risk of how likely someone is to miss that appointment. From that risk, we have sort of 2 main products that we do to address that risk. The first is our scheduling tool. So that helps hospitals know from these 10 patients that are coming to my clinic, maybe 7 of them or 5 of them are 30% likely, 2 of them are 70% likely to miss their appointment. What do I do from a booking perspective to mitigate that and ensure that the doctor sees the same number of patients a day? So we take those complex probabilities and we make that an easy sort of calendar-based application that someone just essentially knows how many patients to book every single day. What we then do as well is we take that risk component of that patient and we then build AI that sort of personalizes how we communicate with that patient as well. So we may send some patients 3 messages, we might send them at different times, we might say slightly different things about their appointments. And what we're trying to do is take the same approach that we have on social media, when we might have like personalized adverts, and try to think about what does that look like when it comes to access to bring people in.
Deep Medical have only been around since 2020, yet they're already working with a number of healthcare institutions across the country. We spoke to Operations Director Sasha Sadiq to gain a better understanding of how widely Deep Medical's solution has been implemented and how it has been received.
Deep Medical Solutions at the moment are live across 5 hospitals, and that's a sort of geographical spread across Essex, Nuneaton and South Warwickshire. And then beyond that, we have a pipeline of around 7 additional trusts that we're hoping to onboard in the coming months. We've had really positive feedback from patients and from teams that use our technology. So again, within the medical community, I think there is a really good awareness that this is a problem. So some of the feedback we've had is, this is brilliant. I'm seeing the number of patients that I'm expecting to see every single day. I'm not staying late because extra patients aren't being booked in. And additionally, I'm able to see the patients that I want to see that are sitting on wait lists for quite a long time.
Recently, Deep Medical worked with Helpforce, a charity with a network of volunteers across the healthcare space, on a project for George Eliot Hospital. We wanted to learn about Deep Medical's impact in this real-world example of their technology in action.
What the volunteers were doing is they were making appointment reminder phone calls at random to patients to try and sort of engage them and encourage them to come in for their appointments or offer them support if they were going to struggle to get in. And what was really cool there is we were able to go in, take that amazing volunteer network and basically onboard them onto our platform and support them to begin making those calls in a really targeted manner. So really focusing in on the patients that are at the highest risk of not showing up to their appointment or struggling to show up to that appointment. And some of the insights that we got from that piece of work was so interesting and really valuable for us to share back with the trust. So why are people struggling to show up? Are there other issues going on, such as them not receiving clinic letters or not knowing that they had an appointment? So there was that side of it around that amazing sort of mining of feedback from patients. But as well as that, there was the other side of supercharging these volunteers. So where previously they were maybe able to make X hundred phone calls and doing it in a random way, often phoning patients who would have always shown up, we were able to really supercharge that resource by focusing in on the ones that were the highest risk of not attending or the most vulnerable patients.
Deep Medical champions equal access to healthcare while helping institutions expand their capabilities to serve more patients. Curious to know more? Here's how to reach out.
We're really active on LinkedIn, so contact us through our social media. Equally, check out our website, so www.deep-medical.ai, or email us info@deep-medical.ai.